Welcome, future educators. I am absolutely thrilled to have you here for this explainer. Think of me as your personal instructional coach today. We're going to tackle Competency 003K, which is all about basic healthcare practices. Now, I know when you're prepping for your certification exams, it is so easy to get bogged down in the textbook definitions, right? But my goal today is to help you connect that exam theory directly to your future classroom. Because, well, very soon you won't just be passing a test, you'll be managing a room full of young learners who are absolutely depending on you.
So here's our roadmap for today. We'll start with the classroom reality, move into understanding key health concepts, look at applying concepts in class, reflect on your practice, and finally, look into your future classroom.
All right, let's dive right into Section 1, the classroom reality, why this competency matters.
As you prepare to become a teacher, you're probably spending a ton of time thinking about lesson plans and academic standards. But before a student can learn, they absolutely have to be safe. So picture this. You're in the middle of a fantastic lesson. A student raises their hand, and instead of answering your math question, they complain of a really sharp pain in their stomach or their chest. You look at them. There are no scrapes, no bruises, no obvious signs of a fall. They look perfectly fine on the outside. So what do? You know, this isn't just a hypothetical. This is a very realistic instructional challenge that you will face, and it's exactly why understanding basic healthcare practices is a non-negotiable part of your professional responsibilities.
Moving on to Section 2, understanding key health concepts, building your professional toolkit.
It's vital we connect this terminology to that opening scenario. So, an internal injury is damage that occurs inside the body and may not be immediately visible. Remember our student who looked perfectly fine on the outside but complained of pain? Well, teachers have to be hyper-vigilant because the most serious damage often isn't obvious at all. You can't just rely on what you can see, you have to rely on what the student is communicating to you.
And you know, that communication usually comes in the form of symptoms. A warning sign or symptom is a physical or emotional indicator that might suggest an illness, an injury, or a health concern. Fun fact, children under 8 actually really struggle to localize pain, meaning a tummy ache could literally be a symptom of a sore throat. That's exactly why teaching them this vocabulary is a vital part of personal health and safety education. They need the tools to tell you when a warning sign is flashing.
Recognizing that symptom early is absolutely crucial because it allows for early detection and screening. This basically means identifying a health problem in its early stages before it becomes severe. And screening, that's simply a health evaluation used to identify these potential problems. So why does this matter for you? Because as a teacher, your early observation, detecting a student acting out of character or looking unusually pale, that can lead to screening that dramatically improves a student's health outcomes. You are literally the first line of observation.
And that brings us right to the healthcare response. This refers to the actual actions taken by individuals or health professionals to address the concern. Do you see how these concepts connect into a chain? It's like a giant puzzle. A student experiences an internal injury. They communicate a warning sign or symptom. You assist in early detection, which immediately triggers an appropriate healthcare response. This is the exact sequence you need to understand.
Notice the really stark contrast between these two approaches here. The exam, and honestly, the teaching profession in general, heavily emphasizes prevention, which means taking proactive actions to reduce the likelihood of disease or injury in the first place. When you combine prevention with early detection, you have a super empowering, proactive approach to student health. Compare that to the sheer danger of just waiting for symptoms to worsen. Waiting can turn a minor, totally treatable issue into a full-blown emergency. As an educator, you always want to be on the side of prevention and early action.
All right, Section 3, applying concepts in class, from theory to practice.
So what does this actually look like in your everyday classroom? Well, imagine a 5th grade teacher conducting a health lesson. They aren't just standing there lecturing, they're actively teaching their 10 and 11-year-old students how to recognize specific warning signs of illness. They're discussing things like a sudden fever, persistent fatigue that just won't go away even after resting, or difficulty breathing. The teacher is grounding those abstract health terms into physical realities that the students can actually understand and actively look out for.
During this lesson, the teacher provides the students with a very clear, actionable structure. Step 1, recognize the warning signs in yourself or a friend. Step 2, notify an adult immediately. And Step 3, the adult will help seek medical attention if necessary. By teaching these exact steps, the teacher is developing the students' habits that support personal health and safety. When you're planning your own health education lessons, this is exactly the kind of clear, empowering framework you're going to want to provide for your students.
Now for Section 4, reflecting on your practice, making instructional decisions. As your instructional coach, I want you to just reflect for a moment. How would you help a young student articulate an unseen symptom, like an internal injury? If you're teaching first graders, for example, they might completely lack the vocabulary to explain exactly what kind of pain they're feeling. They might just cry or say their tummy hurts when it could be something way more severe. So what instructional decisions would you make to help them? Maybe you'd use visual charts with faces showing different levels of pain. Maybe you'd practice role-playing health scenarios. You really need to consider how you'll support learners who just don't yet have the words to describe what's happening inside their bodies.
Furthermore, what instructional decisions would you make to normalize seeking medical help in your classroom culture? Students should never, ever feel embarrassed or scared to say they feel unwell. How are you going to build a supportive environment that emphasizes prevention and health maintenance? These are the real, practical questions you need to ask yourself as you prepare to lead a classroom.
Okay, Section 5. Into your future classroom. Preparing for the exam and beyond.
Let's lock in the most important information for your certification exam. If you memorize anything regarding Competency 003K, it literally needs to be these 3 takeaways. First, early detection improves health outcomes. Second, it is an instructional requirement that students learn to recognize warning signs of illness and injury. And third, prevention and health maintenance are the major overarching themes in health education. So whenever you see a multiple-choice question on this topic, always look for the answer that champions early intervention, student awareness, and preventative care.
But looking beyond the exam, this is what I really want you to take away today. When you master these basic healthcare practices, you aren't just checking off a standard. You are equipping your students with life-saving tools. You are becoming a protector and a guide for your future students. You're teaching them how to listen to their bodies and how to advocate for their own well-being. And that is incredibly powerful work.
I'm going to leave you with this final provocative thought to carry with you as you continue your preparations. How will you make health and safety an everyday reality in your future classroom? It's not just a one-off lesson, it's a culture you build. Thank you so much for joining me for this explainer. Keep this question in mind, keep studying hard, and I know you are going to be absolutely fantastic in your future classroom.